Welcome to the July meeting of the Georgia One Health Consortium. So happy to see all of you here. And I know some people will be filtering in soon. Thank you so much for joining us. We have a lot of really fun announcements happening and a great presentation coming up. So I'm just going to kind of run quickly through these slides. I always start off each meeting with kind of like an update of like where we're at. Really happy to say we have another month of growth. So we're up to 270 people who have signed up to be a member of the Georgia One Health Consortium. So really excited about that. And we have 84 folks on Circle. So again, up from the last meeting. Just as a reminder, our member engagement platform is Circle Community. We try to post all of the announcements there or any type of links, but then also it's available to all the consortium members to post about their happenings as well. So if you just recently published a paper or you're going to another conference and you want to see if anybody will be there, just it's really there to really provoke conversation around One Health across the state of Georgia. So definitely join Circle if you haven't. And I will drop these PowerPoint slides into chat, and I will also upload them in our shared folder so that you have access to all of these links. So if you maybe accidentally deleted your welcome email that gives you how to join the Circle link, you can just click right here on this link that says Circle, and it will take you straight to the invitation. You don't have to pay anything to sign up, but one thing I do want to kind of encourage everyone to do is if you will go down each one of these spaces, so you see member directory, monthly meetings, and click join this space, then you'll get notified whenever somebody posts to that space. If you don't say join the member directory, your face won't be in the directory. People won't know that you're there and can reach out to you. So just definitely go through and join all of the spaces that you think are relevant. But I think it's a really cool platform, and we would love to see more people in that space. Also, we still have the consortium website. If you are a part of an organization and you don't see your logo represented on the website, please send me an email at ihla@georgiasouthern.edu and we'll get it posted. This is just a way to share about your participation in the consortium. Now, I saved some of the best information for last. I'm really excited to say that we have been able to get the second annual Georgia One Health Symposium off the ground. It was kind of a rocky start. We were kind of flip-flopping with dates and because we were trying to find a good location for everybody. But we settled on September 24th through the 26th. It's going to be held at Mercer University at the central part of the state, Macon, Georgia. So hopefully it'll be easier for people to come if you're in the northern part rather than driving all the way to Statesboro. And it's going to be hosted at the Mercer University School of Medicine. So we're really excited about that partnership, and we hope you can make it. So just to kind of give you some more details about what to expect, we are following kind of a similar layout that we did with the first annual symposium. It was a lot of fun. We really built the symposium around conversations and networking. So if you want to meet people across the state who have an interest in One Health, this is really the place to do it. So on September 24th, we'll start off with our evening welcome reception. Then September 25th, we will have the all-day symposium, breakout sessions, panel discussions, stuff like that. And then new this year, we've decided to do a whole community-focused agenda. New this year on that Saturday, we are going to be teaming up with the People and Pets Project to hold a community open house event. They're celebrating a new location, and they are a premier One Health clinic here that really serves amazing populations across the state. So we're excited to be teaming up with them. So that was a little overview, but just to give you some more details about each of the days, the evening network reception is going to be held at the Capricorn, which is so cool. Me and some folks went and visited the Capricorn not too long ago, and it was so cool. There's a lot of history that is wrapped up in this building, especially as it relates to music in Georgia. So, heavy hitters like Otis Redding, Allman Brothers Band, the Marshall Tucker Band, like they've all either have roots or have recorded in this building. And so really cool to see. And they have a great reception space. And they've even agreed to open up the recording studio for us all to visit. And when we were visiting there, just kind of understanding the space and layout, they were actually, it's still a recording studio that is active today. And I believe the one of the band members of the Rolling Stones was going to be there the next day. So a lot of really cool history. And of course, we know how impactful art and science is when it mashes up, and what better mashup than One Health, right? So that's going to be our evening network reception. Then we're going to be at the Mercer University School of Medicine. They have a great auditorium space. We also will have space for exhibitors and sponsors. We'll have space for student and early career professionals to have posters set up about a wide variety of topics. And then we even have breakout rooms. So we're going to kind of split up into topics that, interest different folks. They can decide which avenue they want to go down, but really, really excited. And again, this is going to be a community focused event. So we're hoping to have a lot of community based organizations coming to meet with governmental organizations and academia. We're really, really excited about that. And then, of course, the community open house event with the People and Pets Project. They are planning for some demonstrations. You're actually going to see One Health in action. So they'll have a setup so you can see what a One Health clinic looks like when it is operating. It won't be operating when we're there, of course. And then we're going to have like a lot of fun outdoor activities. Hopefully it won't be too hot, but it'll be another chance to really, meet people, engage with exhibitors and other community organizations. So the biggest thing, register for the symposium as soon as you can. Again, I'll drop this link into the chat once I'm done, but the evening reception is $20. The all-day symposium on that Friday is $35. If you sign up to come to both, then we have a price reduction of $50. We are trying to keep costs extremely low. So this does not even cover the food that we'll be serving. So certainly, please just share the word. The more people that come, of course, there's more sponsorship and exhibitor interest as well. So the deadline to sign up is September 8th, but please don't wait till September 8th, just in case something happens. We have to turn in head counts really soon after. So just please sign up as soon as you know that you can make it. So I will drop this in the chat too. So this is our symposium poster abstract sign up form. So basically, if you're a student or early career professional and you would like to present a poster about any One Health work, it doesn't have to be like a research study. It could be a quality improvement project. It could be a case study. It could be an innovative product that you developed. but really focused on One Health and the intersection across health sectors. This would be a great opportunity. We're going to have designated time and space on that Friday in the all-day symposium in order to drive people to the posters. So really looking forward to that. Everything will be peer reviewed that is submitted. So that's good, of course, for your resume as well, from professionals in One Health. So definitely get everything submitted by August 24th. And then we will let you know if your poster is accepted by August 31st so that you can be sure to hit that registration deadline of September 8th. So we have everything flowing. Also, if you know anybody or any organization that is interested in exhibiting or just simply sponsoring, we have a lot of opportunities available. Again, this helps keep the registration costs low. So please spread the word about this. We have a really nice sponsorship packet, and we're just asking for a commitment deadline by August 31st. So please spread the word there. I know I'm the one that is frequently talking during these meetings, but there is a whole amazing team of folks that are helping out, whether it is the whole team at the Institute for Health Logistics and Analytics at Georgia Southern, as well as volunteers across the state. So you can see their names here on the screen. None of this would have been possible if it hadn't been through the efforts of so many folks. So I just want to thank you to IHLA staff and to all of our many volunteers. Of course, if you want to volunteer, there is always room at the table for you as well. So what are the next steps before we go into our talk today? Please continue to spread the word about the consortium. Since we founded the consortium, we have not had a single month without growth. So I want to keep that trend going. Please register for the symposium. If you would like to have a table there, please let us know and we'll get that worked out as well. Join the Circle community and watch for updates. Hint, we are going to have a discounted rate hotel block being posted soon, so that you can kind of save some money on hotel costs if you're traveling. We will post it first to the Circle community. And then we will send it out to the whole consortium. So if you want to get first on that block, then maybe that's a good reason to join the Circle community. Our next monthly meeting is August 28th. Really excited about that. And then we're not going to have the monthly meeting as normal on Zoom in September because we'll have our annual symposium. So if you're ever looking for collaboration opportunities or want to get more involved with the consortium or the symposium, please reach out to IHLA. The email is here. And that is all for me. I know that was super quick. So I apologize, but I want to get to the main event today. But while he is setting up and about to share his screen, are there any questions about the consortium or symposium that anybody has? Okay. Well, this is great. This is great. Okay. Dr. Weezy, do you want to introduce our speaker? I don't see Dr. Samples here, so.
Yes, Dr. Sampo, she's in another meeting.
Okay.
So I'll go ahead and introduce Dr. Aftab. Dr. Aftab is one of the faculty at Fort Valley State University and is very great in his craft. We are glad to have him here. So Dr. Aftab, you're welcome to the One Health group. Thank you for your time and the floor is yours.
Thank you, Dr. Veazey, for introducing me. Hello, all. Thank you for having me. I know this presentation has been due for a long, due to some condition, I was not able to present it. But today I have a chance, and the way this is set up. So my area of research over here is animal health monitoring systems, specifically diagnosing them at a relatively faster speed, so rapid identification of animal disease condition. And the title is going to be From Animal Health to Algorithm, One Health Surveillance System. We specifically work with small ruminants, goat, sheep, and different conditions. With that being said, Let's move. What's going on here? Okay. So why surveillance matter in One Health? The very first thing is that why to keep monitoring. As we know, as we all have this problem, especially in small ruminant, that parasitic disease affects animal health, productivity, farmer income, and food security. We are more focused on resource poor farmers. Those have smaller herds and are having more problem with livestock management. Some of the conditions or some of the techniques that are available, they are delayed diagnostic, increased treatment cost, and resistance development. And so what we need early detection, scalable, field-ready systems. So as you can see in this picture, we have disease burden, animal welfare or poor welfare, anemia, lower productivity, and economic loss. And when I joined the lab, I was like, so to give you a background, I did my PhD in food sciences, specifically in poultry, and it was an interdisciplinary work with AI machine learning at that time when it was started to come up as very young, at very starting point in time. So it was hard for me to understand things because I don't have a lot of computer science background. But so the surveillance gap, the bottleneck is that when we are working with small ruminants, and when I came in, I saw that conventional diagnostic techniques are there. I'll give you some examples, like to test the fecal egg count or parasitic egg in the burden. We use microscopy. We do the fecal egg count, which is labor intensive. You need a trained person. Then we have pharmacy scoring. Pharmacy scoring, basically a type of scoring where you look at the lower eye conjunctiva of the animal and then compare it with the scoring card. And it goes from 1 to 5, 1 being very healthy, 5 being very anemic or severely ill. Then we have lab diagnostic technique, which is hematocrit analysis or packed cell volume, where where it is time consuming. You need person who is well trained in that, and it's a time consuming process, taken into consideration that you have to have someone collecting blood sample in field, then bringing back, running through the sample. And economically, we were talking to Cornell University to get an idea that how much it cost for one person or one sample to run from sampling till result. It's around like $40 per sample, which is not feasible for a resource poor farmer. So now we need something fast, accurate, and at the same time it needs to be effective. That's why we are getting into why AI. We all know, we all have seen over the period of time from last 2 3 years, we have seen that how this AI has been moved from initial to now very advanced stage. So with this, as AI as a central brain, is just a core framework concept where we have integration of images, signals, we have data from field collection, from real observers. Then we have a central hub that we want to have a central hub that process the data and sends the recommendation to a small ruminant or small resource poor farmer or someone who wants to have access to the data. So our framework here at Fort Valley is AI-powered livestock health monitoring systems, where we have animals, we have goat, sheep. Now we are collecting almost 3 and 4 different type of data. I will cover that in next upcoming slide. And then we have our in-house developed apps and models that we are using to classify those risks and animal health. And then we have our digital twin framework as well, a predictive decision and support system that tells whether treat to the animal, not treat, or look after or monitor the animal after that. So then a farmer or a veterinarian can take action towards treat it, not treat it, and so whatnot. So our case study for this presentation, what we have 4 different case studies. First, we are using bioelectrical impedance, and I'm sure you all know that what is bioelectrical impedance. So we are actually what we are doing, to put it in a understandable way. If you have seen those at gyms or people, you just go touch the rod and it sends electrical signal into your body and collects the parameter like percentage of fat, percentage of protein. So that's the main concept over here. So we wanted to see if that also works in animal, and can we predict healthy versus parasitized animal or healthy versus non-healthy animal. The second case study we have is digital pharmacy scoring, because perception to color can vary from one person to another. For me, pinkish red is red, or red is what shade of red. So there is lot of subjectivity. And to reduce that subjectivity, we introduce this coloring scoring into digital format correlated with hematocrit value or PCV, pack cell volume analysis. So now we have an objective, solid objective number to correlate with that image. And by using image classification app, that is available with in-house available. And you can just take the picture of lower eye conjunctiva and get the recommendation whether you have to treat the animal or not. Then we also developed uh, an in-house biosensor, which a farmer can make in their kitchen and use it with AI model that can give them precise condition of animal without sending samples to lab or needing someone with training how to run pack cell volume and pack cell volume analysis. The fourth case study that we are having is radio frequency wave. To put it in a very simple way, radio frequency wave is just like using a Wi-Fi signal to detect animal health. So we used 2 gigahertz to 18 gigahertz of frequency range and isolated specific frequencies that are representative of that specific condition in animal. And those frequency range are in range of Wi-Fi signals as well. So to put it in a general understanding that yes, you can use Wi-Fi signals to identify animal health. So the first case study here was BIA in animal. So this is what the device looks like. So the problem was parasitic infection. Traditional diagnostic methods are slow. We need something rapid, accurate, and non-invasive for parasite classification. Image in the middle is the bioelectrical impedance device that we have been working with the company itself called BioLima. And this is the second prototype device as compared to the previous one. Previous one was chunky, heavy, and you need to have both hands connected with wall plug and everything else. But this one is size of a matchbox. You can carry in your pocket, collect the data, and use it through your phone, upload all the data, and get it analyzed over the cloud-based server. So we took the samples on animals, healthy versus non-healthy group. Those were male intact Spanish goats. We used algorithms such as support vector machines, neural networks, and k-nearest neighbor. We used data for classification and prediction, and this work got published in Frontiers in Veterinary Sciences as a proof of concept work. We are also two of the other works, extension of this work, are under review with Smart Agricultural Technologies. The second work that I was discussing about digitalized Pharmacia score. So this is actual Pharmacia card. It was named after the scientist called Fafa Malan chart in South Africa. And I'm working, we have the collaborator over there, Dr. Jan van Wyk. And we are collaborating with them, and he is one of the developer of this Fafa Malan chart. Now, the objective was to automate the Pharmacia scoring using AI, and we did comparison between CNN model, which is convolution neural network model, backpropagation neural network, support vector machine. So we collected almost 4,700 images over 6 months of time, weekly imaging, PCV data was collected. So as I said, subjective to reduce subjectivity, we have to have PCV score and correlate those images together to develop this model, train the model, and develop the app. Now, this is how you do it in field, which is labor intensive because if you have 200 goats, you have to monitor them all at the same day. That's going to be a pain. And this is how you do it in field. You hold the goat, lower eye conjunctiva, and compare it. That's the way it is done. So we wanted to digitalize it, and this is the result. And what we saw that our proposed CNN model was performing better as compared to the other studies that have been. So this is the fourth study so far. I don't know at the time when it was published, and there are only 3 other studies in different countries that they tried to do the pharmacy scoring using other models as well. So we used image classification model, but others have used classical machine learning algorithms such as random forest, support vector machines, and those. Now, if you remember, I was talking about a blood biosensor that a farmer can develop in their kitchen. This is the work I'm going to show. So as I said, that hematocrit or PCV value, you need a person who can go out in field, collect blood, bring it back, run the analysis, and it's going to take at least 6 to 7 hours of time. Now, think of this way. What if you just have to prick the ear of the animal as we do for our blood glucose testing? You have a filter paper that you have a drop over there and then get your results in 60 seconds. And that's exactly what we did. We reduced down that time from 6 hours to 1 minute and 30 seconds. What we actually did that this is just comparing hematocrit, pharmacia. So I'm coming to the objective of this study. So now if you will notice on this different blood patterns at different PCV score, you will notice that figure A is for healthy animal blood spot or blood pattern. Figure B is pharmacia score of 2. So to give you a range, 1 and 2 are healthy, A and B are healthy, C is a borderline animal, D is an anemic animal, and E, or fifth image at right-hand corner in the down, is pharmacia score of 5, which is severely anemic. If you'll notice, there's a huge difference between 1, 2, or A, B, C, D, and E. This is exactly what we did. So we developed this sensor that a farmer can create it at their place in the kitchen. Just take 2 drops of glycerol with a Whatman filter paper number 1, soak it, take a drop of blood, put it on that soaked filter paper, and take the image. And we have the app, in-house developed app. You can take a picture from that, and based on the finger-like projection at the end of the image after 1 minute 30 seconds, it tells you what is the PCV score and a related pharmacia score that farmer can use to treat their animal. That decreased down the time of analysis, cost of analysis, so it helped economical, it reduced the expenses. At the same time, you don't need a trained person to tell you whether you have to treat your animal or not, or a trained person to collect blood samples and whatnot. So this work was also done in 2024 in Frontiers in Veterinary Sciences. Now, the fourth study I was talking about, where we are talking about Wi-Fi signals to detect the animal. This technique is basically we set this device on the scale, near the scale, and it takes only 1/10th of a second to send a radio frequency wave into the body of the animal reflects it back and tells you whether the animal is anemic, non-anemic, based on the reflectance phase angle and amplitude difference. So this is just the workflow, data flow, how this thing works. So we have the animal experimental setup where we let the animal stand on the scale and move. So while the animal comes in, gets stands on the scale, in that time, RF waves goes through in, comes back out, get you the signal, and the automated model classifies it whether the animal is anemic or not. If the animal is anemic, how much they are anemic, or what is their Fama-Chai score or Pfaffer-Milan chart score. So at the end, we have the AI-driven innovation for smarter surveillance. So AI is enable earlier, more objective and field-ready livestock health surveillance system. With the use of AI and these rapid identification techniques, we have non-invasive sensing more developed, much more less painful, more humane, non-invasive. We can make more better support or TST, which is targeted selective treatment, and reduce the resistance pressure. And it, in our understanding, based on what we are doing, that it directly advances One Health, because yes, it is being done on small ruminants at this time, but think of its application in human medicine or in other companion animals. Like one of our student, he is doing internship in Tallahassee, Florida, ISI. Now he is trying to use bioelectrical impedance in cats or feline animals to detect their health condition. Recently, I was in a committee where they are trying to use image classification models to do body score conditioning for dogs, that whether the dog is healthy, obese, or too skinny. So, yes, the proof of concept work is there with small ruminants, but we have more and more areas that we can include in these type of studies. We can collaborate and improve One Health overall improvement in One Health related areas. So the future spec or multimodal surveillance ecosystem development, which is integrate multimodal data in the sense like we have different data sources, like let's say observational studies, collected data, images. So what I feel personally at this point or over the period of time, I have been talking to people that data are being very siloed. There's no data sharing, the very first thing that needs to be there. Plus there is different type of data which needs a common language to be translated and transcribed. So in a sense, we have images, we have audio recordings, we have video recordings, we have numbers that needs to be translated into one understandable language. So we need that central hub. Then we need those data set to be analyzed or understood by someone in the field who can translate that with for everyone else and then validate those results to different areas and then link that to smarter interventions and expand in different areas of research. Not just with the small ruminant research, we are also working with GIS technologies looking at site-specific fodder management, which is plant science. We are also collaborating with Land, Water, and Resource Management Center of Excellence at TSU, where we are working with water resource management, field areas, forest, entomologists. We are also collaborating with entomologists as well. With that being said, thank you, and I'll I'm open to take any questions and comments.
Great. Well, thank you so much for that presentation. I mean, just a couple of thoughts with a question wrapped up in it. I think like siloed data is something that we've always, fought with just because of the, I guess, origin stories of many of our data systems. And to me, there has always been talk about data integration and working across systems. And of course, that would make the One Health mission that much easier to obtain if that was to ever be the case. But now with AI on the scene, it's becoming more and more of a reality. And I am really excited about it. And this is some work, and this is an area of work that we're working in now too with WHO Afro. And I guess one of my biggest questions is you have the like proof of concept done. And one thing that I always think about is scalability and implementation and all of the science that goes with that. Have you had any like leads of potentially scaling any of these projects? If so, who do you think the primary funders will be? And then the second follow-up question is, if you don't have kind of that bridge to the community, what do you think will be the biggest barriers to implementation if once you gain that bridge?
So I'll let me rephrase the question. So the question is like the very first question is there any scalability available for these proof of concept work? And the second part of the question, who will be my funders? So in terms of if we talk about scalability, I'll give you one example that I am currently working on. We have a collaborator in Ghana, Dr. Francis, and he is working with child anemia, early age child related anemia and obesity. And we are actually in process, or he is actually in process of collecting lower eye conjunctiva images from the kids and then developing these models specifically for human AI app development where it can be used with other in early stage. So that's one implementation. The second implementation, we are working here at USDA Byron Fruit and Nut Facility with some of the techniques that I was told that I had. So I had to cut down my presentation almost 3 by 4 in terms to cover everything, but I didn't know that I will be able to finish this early. So we have these telemetry, how we have the Fitbits or trackers, step counters. Same way we have, most of you know that those RFID tags that they are putting on the cows, right? But the thing is that the tags over here they give you a lag data of 20 minutes. So if something happens, that gets uploaded every 20 minutes. And that lag of 20 minutes can cost you severe to a farmer. What the tax we collaborated with a company called Atom Incorporations in South Africa, the tax they are making, there is no lag time. So you can actually see their live activity. So we have those tags on animals and we are tracking their health, not from the perspective that when they are getting sick, we are tracking them down that how other factors are contributing to their health. Let's say soil temperature, soil moisture, wind speed, wind direction, moisture, average heat, maximum, minimum. So all that, and we have this framework working 24/7 on decision and support system. It collects data and then it evaluates the animal health, and it tells you in real time that what animal, so it collects their movement, it collects their heartbeat and everything, and that it sends you an alert saying that, oh, this animal has not have not been moved from one this particular point in an hour. Go and check. So yes, that's the scalability and collaboration with others. Right now, I believe there are some funding agencies, such as in terms of private, there are Gate Foundation. I'm sure most of you know that they have increased their timeline of submitting grants. Gates grant. I think for 2025 there was a diarrhea burden for Nigeria or lower income countries. Those are the fundings in terms of One Health, and there are some big SAS grants or SAS grants from USDA NIFA, like re-emerging and merging disease and that sort of thing. And yesterday there was a grant open up for swine influx and outflux. So yes, there are NIH grants, Gates grant, and USDA NIFA grants are available. Yeah, I hope is that
Yeah, no,
you meant.
I just find it interesting. The reason I asked about the funding aspect is, of course, there's like the government agencies that fund it, and of course, United States is looking to do more in that space. But there also seems like a huge opportunity for commercialization and working with private industry, which traditionally has not been. I mean, it happens in certain contexts, but not in others. So. Thank you for that. I'll open the floor up for other questions. I have several more questions.
Go for
Just
it, no
because this
problem.
is a topic I'm interested in. While other people are thinking about their questions, I did a talk on AI and One Health, and the majority of the room like really enjoyed it. And then I had one person that was really questioning the environmental impacts of the use of AI. With any new technology, there is always the concerns, both real and abstract, on its impact, from a human, animal, environmental health perspective. So I guess, what would you have to say to our audience about, kind of weighing the risk and benefits of AI enabled technologies with the potential footprint that AI has, especially with all of the large data centers? Any comments about that?
Um, that's a gray area, but in terms of me looking into that and saying that pros and cons, the thing is that it depends how much data are you trying to process. The thing is that, so let's say if we look at our research perspective, that we are researching, we are researchers and we need to do research, collect data and process it. That is going to be happen on your laptop as same amount of energy you are consuming while running a song, writing your Word document, and doing two or three tasks at the same time, right? But when you go for a data center, they are having billions of observation points coming in and out in real time. And yes, at that point, we need to use energy to cool down those servers, fans, and all that. Yes, I got that point. But in terms of what we are contributing, in terms of energy and pros and cons, I think, yes, 10 years, 20 years, 30 years from now, that would be something to worry about. But at this point, the speed we are moving, in terms of research, it's not going to affect. Yes, there are pros and cons, but uh, with larger and larger amount of data set, yes, there is going to be consequences. So I won't say no, there is no bad effect or anything like that. There is always equal action, equal reaction of an action. So it's going to be there, but not from perspective of a researcher collecting data and contributing it to scientific community.
Thank you.
Thank you.
Okay, any other questions? Okay. Well, not wanting to take too much more of y'all's time. Just thank you so much for coming, Dr. Siddique. I really appreciate the insight that you have, and it was just fascinating case studies. And it was cool to hear about all of your research. I really think this is an awesome application, One Health application about how, we know all of the different ways that livestock impact human health, whether it's, our food source, whether it's our income source. It's such an important topic. So thank you for joining us. And thank you, everyone, for being here. And we'll see you in the next monthly meeting in August. And
Right.
hopefully, we will see you at the symposium in September. So take care.
Right. And please feel free to contact us if someone wants to collaborate, and we are open and will be able to help.
Great. Thank you.
Thank you.